This segment sponsored by GBMC Healthcare.
So January is Cervical Health Month, but there's really no better time to discuss the risk and symptoms of cervical cancer, Christina.
Yeah, here to answer our questions, and hopefully yours too, is Dr. Kimberly Levinson. Thank you so much for being with us.
Thank you so much for having me.
Of course.
Yeah. So doctor, what exactly is cervical cancer and what are some of the early symptoms?
Yeah, so cervical cancer is a type of cancer that affects the opening to the uterus, which is called the cervix. So when cancer starts in this area, essentially that is what cervical cancer is. Realistically, there's not usually any symptoms of cervical cancer. Occasionally somebody can have a little bit of abnormal bleeding, but most of the symptoms actually don't arise until cancer is advanced. So that's what makes screening for cervical cancer so important, and primary prevention with vaccination as well.
Absolutely. And do we know the causes of cervical cancer?
Yeah, so the major cause of cervical cancer is the HPV virus, or the human papillomavirus. That is the causative agent of the vast majority of cervical cancers.
Gotcha.
And the good news, though, through prevention, you can actually not get HPV.
Yeah, so actually there's primary prevention, which is with vaccination, which basically prevents the virus from taking hold. And then there's also secondary prevention, which has to do with our screening practices, which also are great prevention of cervical cancer and very important methods.
I see. How frequently should we be getting these screenings?
Yeah, so it partially depends on your history, and it partially depends on which type of screening you get. So it's a little bit complicated, but and also your age as well. So women should begin screening at the age of 21. They get pap smear screening from 21 to 29, and that's every 3 years. Once a woman hits the age of 30, then you have some options for screening, and those options include either a primary HPV test alone, co-testing with a pap smear and an HPV test, or a pap smear alone. If you get the pap smear alone, it's every 3 years. If you do either of the other two tests, then it's every 5 years if you're negative. If you have other history of cervical dysplasia or any findings that are abnormal, then the screening usually increases. So you really need to discuss with your doctor and know what your history is.
Gotcha.
Sure. Is this genetic in any way?
This is not genetic, no.
Okay, so we really can prevent this. It's not just something that's going to be passed down.
Absolutely.
That's good to know. So let's talk about actual treatment options for cervical cancer.
Yeah, so it's largely dependent on what stage it's found in. So for many early stages, we often can treat with surgery. Once cancer is more advanced, then we have to look at some other options, including chemotherapy and radiation.
I see. So talk to us about what happens. What does that surgery actually entail?
Yeah, so usually if somebody is diagnosed with an early stage cancer, then it usually is a radical hysterectomy. And what that means is it's removal of the uterus. But when we say a radical hysterectomy, what that means is that we take some of the tissue surrounding the cervix as well to help make sure that that tissue is not involved in the cancer as well. So it's a little bit of a more intense procedure and does require a little bit more fine dissection and is a little bit more complicated, but again, it's a surgery.
And what's the survival rate with somebody who's actually diagnosed with cervical
so again,
cancer?
it just really depends on when you're diagnosed and how early this is caught. We do a good job of curing early stage cancers, so again, that prevention and finding this cancer early is very important.
Is this going to affect a woman, so say she has a diagnosis, will it affect her chances later of having a family if that's what she intends to do?
Yeah, so it can. We do have some fertility preserving options for treatment, and those again are really in the very early stages, or more importantly, if we're able to find the precancer or dysplasia, then we really do have fertility preserving options. Again, gets back to that screening process and why that's so important, because then we can give women options. When this disease is found later on, unfortunately, we generally do not have that option.
Sure, once you have a hysterectomy, it is what it is. Yeah. Talk to us about how HPV actually causes cervical cancer. How does that happen?
Yeah, so HPV is actually a sexually transmitted disease. It's not a sexually transmitted disease like we think of chlamydia or gonorrhea. The way that I kind of describe it is it's kind of like the common cold of sexually transmitted diseases. So just about everybody gets it at some point. And again, unless you're vaccinated. But most people will clear the virus just fine. The immune system will help to clear it. But if the immune system doesn't clear it effectively and kind of goes, oh, no big deal, we don't need to worry about that, then that virus can actually persist in the cells in the cervix and cause changes to those cells. Those changes then go on to become precancerous cells or dysplasias, and those are things that we can pick up with screening. And then those can go on to become cancerous if we do not pick them up.
So do we know why some women, you know, like their bodies are able to fight the virus and others don't?
Yeah, it's a really good question. So, you know, certainly immunocompromised women are at increased risk for this virus progressing and becoming dysplasia or cancer, but it's kind of, you know, that is not necessarily the only reason. So it just is, the body may just not be paying attention to it there and not be kind of saying, oh, that's something important for me to pay attention to.
This is interesting. And of course, ask your physician if you have any questions about your own personal health. Where can we go to learn more?
Yeah, so you can go to our GBMC website. We have information there, or visit the American Cancer Society for more information across the country.
Fantastic. Thank you so much.
And you explained
Thank you for
this
having
info
me.
in such an easy way for people to understand.
Very
We really
helpful.
appreciate
Good.
that. Absolutely.
Good. Absolutely. Thanks for having me.